Have you ever wondered how common falls are among the elderly population? Well, you might be surprised. Each year, between 30 to 40% of individuals aged over 65 experience a fall. This figure jumps to nearly 50% for those aged over 80. Interestingly, falls are just as likely to occur in men as they are in women. However, women are more likely to sustain an injury from a fall. Of these falls, 5% result in hospitalization. Serious injuries such as hip fractures, head injuries, and lacerations are associated with 5 to 10% of falls. 1 to 2% of these falls lead to a hip fracture. In terms of mortality, 15% of those who fall die in hospital, and there is a 33% mortality rate within 1 year. As you can see, falls are not only common in the elderly, but they can also lead to serious health complications and even death. But why do these falls occur? The answer is multifaceted. Let's delve into the causes, or what we call the etiology of falls. It's a multifactorial situation with both extrinsic and intrinsic factors at play. Extrinsic factors, or external ones, include environmental aspects like the layout of a home, lighting, stairs, and footwear, along with accidental causes and, sadly, even abuse. Medications and substances like alcohol also come into play. Falls often occur within 1 month of hospital discharge, during acute illnesses or exacerbation of chronic illnesses. Now let's look at intrinsic factors which are internal to the person. These include orthostatic or syncopal causes, age-related changes, and diseases associated with aging. Conditions like arthritis, muscle weakness, visual, proprioceptive, and vestibular sensory impairments, cognitive issues like depression, dementia, delirium, anxiety, cardiovascular, neurologic, and metabolic disorders can all contribute. Past history of a fall is also a significant factor. Understanding the causes of falls is the first step towards preventing them. Certain physical findings and drugs can increase the risk of falling in the elderly. When assessing an older person who has fallen or nearly fallen, remember the acronym I hate falling. This stands for inflammation of joints, hypotension, auditory and visual abnormalities, tremor, equilibrium problems, foot problems, arrhythmia, leg length discrepancy, lack of conditioning, illness, nutrition, and gait disturbance. By looking out for these signs, we can better understand and address the factors contributing to falls. Additionally, certain medications can increase the risk of falling. These may include sedative hypnotics and anxiolytics, particularly long-acting benzodiazepines, various antidepressants, antipsychotics and tranquilizers, antihypertensive drugs, antiarrhythmics, diuretics, systemic corticosteroids, nonsteroidal anti-inflammatory drugs, anticholinergics, hypoglycemic agents, and even alcohol. Being aware of these risk factors can help in devising strategies to prevent falls. It's important to remember that the goal is not just to treat the symptoms, but to improve the overall quality of life for our elders. So, how can we prevent these falls? The answer lies in comprehensive investigations and preventive measures. To begin with, investigations are directed by the individual's history and physical assessment. It's crucial to conduct a comprehensive geriatric assessment to identify all potential causes of falls. This might include tests such as a complete blood count, electrolyte analysis, and even a CT scan of the head. But prevention doesn't stop at identifying causes. It's a multifactorial and multidisciplinary approach. This includes health and environment risk factor screening and intervention programs in the community. Muscle strengthening, balance retraining, and group exercise programs like Tai Chi are also essential. Home hazard assessment and modifications can make a world of difference. Simple changes like removing rugs or adding shower bars can drastically reduce the risk of falls. Medication management is another key aspect. Gradual discontinuation of psychotropic medication and management of postural hypotension, heart rate, and rhythm abnormalities can be highly effective. Lastly, lifestyle modifications, such as optimizing eyesight and footwear, and a daily dose of vitamin D, can go a long way in preventing falls. Prevention is always better than cure, and that holds true for falls in the elderly as well. Now, let's delve into some practical tips to prevent falls in the elderly. First and foremost, improving lighting is crucial, especially on stairs where visibility can make a significant difference. Another simple yet effective method is the use of railings on steps and side rails in bathtubs. These provide support and stability where it's needed most. Now let's talk about potential tripping hazards. Loose mats, carpets, and cords can be more dangerous than they appear. So it's always a good idea to keep walking paths clear. Next is the issue of eyesight. Regular checkups and adjustments to prescriptions can greatly enhance depth perception, particularly when adapting to new bifocals. And lastly, let's not forget about footwear. Shoes that fit well and provide good support can significantly reduce the risk of slips and falls. Remember, every small step counts when it comes to preventing falls. Let's make our environment safer for our elderly loved ones. Alright, that's it for our comprehensive guide on falls in the elderly. We hope you found this information helpful and enlightening. If you did, please consider subscribing to our channel, Medicine Health 360, for more high-quality medical and health content. Your support helps us create more videos like this one. Don't forget to give this video a thumbs up if you found it useful and informative. We encourage you to share your thoughts, experiences, and any additional tips in the comments section below. Your feedback and engagement are invaluable to us and our community. Remember, no tip is too small or trivial when it comes to the health and safety of our elderly loved ones. Thank you for watching. Remember, better health leads to a better life. Stay tuned for more informative and engaging content from Medicine Health 360.